I'm June Craven, and I'm here to give you an overview of the Accessible Information Standard and the difference it can make to patients on behalf of Breakthrough UK. The Accessible Information Standard got brought in 2016, which kind of builds on the things that are in the Equality Act, but recognises that, we needed some more accountability there to help people with learning difficulties mainly. But the AIS also covers anyone with impairments, visual impairments, for example, and deaf and hard of hearing people. The Accessible Information Standard, AIS, consists of 5 steps. The first is to ask or identify, asking patients if they have any information or communication needs. You can ask this question as part of registration, then at regular intervals afterwards, similar to asking a patient their date of birth. The second step is to record. Ensure that you have recorded any information or communication needs that the patient has informed you about. The third step is flag or highlight. This can be done by placing an alert on the patient's record to ensure that whenever anyone opens that record, they are informed of anything they need to act on. The fourth step is to share, so that if you refer a patient to another department, you ensure that their information and communication needs are shared so they don't have to inform people again. The fifth and final step is to ensure that you always act on any needs that have been identified. For example, ensuring that there is always a BSL interpreter booked for appointments. Complying with the Accessible Information Standard mostly involves making small changes. It may need a little bit of learning and investment, but it will have an impact on both patient outcomes and relieve pressure on practices. It may lead to less repeat appointments due to things like patients not fully understanding their medication. The Accessible Information Standard is now part of the Care Quality Commission's inspections. Be flexible about when patients can contact the practice. Allow anyone with communication and information needs to book an appointment at any time of day and not be restricted to calling at 8 AM. Wherever possible, offer patients the choice between a virtual and face-to-face appointment. Some patients will find face-to-face more accessible and vice versa. Always address the patient regardless of who they bring with them, unless otherwise requested. Some people may have a communication passport or other document which records information that they want you to know. Ask people if they have one of these. Some neurodivergent patients may need information in advance in order to feel comfortable in attending the appointment. This might be a step-by-step breakdown of what will happen in an appointment, or photos of where the appointment will take place and any equipment involved. On the same topic, consider sensory elements, such as if the room has strip lights that may flicker, or if there is anything else that might cause strong smells, consider offering a different location. Ensure that your practice knows how to access interpreter services, both for translation and for BSL. Remember that although people may have the same impairments, they may have different ways of removing barriers. For example, one blind person may prefer information by email so they can use screen reading software. Another blind person may prefer it in audio format so they can listen to it. Make sure there are posters around the practice so that patients are aware of how you can support them. Have them in clear, large fonts and displayed at eye level, particularly for shorter people and wheelchair users. If someone needs to lip read, ensure that you are in a well-lit place with no shadows. Don't cover your mouth. Don't exaggerate or shout. Alternative formats can be as simple as using a larger font. If someone emails you in a specific format, the simplest way to make it accessible is to reply in the same format they used. Easy Reader is a format that is accessible for people with learning disabilities. Your practice may have access to templates, and there are other resources available. Aim for one idea per sentence and use short words. Ensure that the information is clear and you know what the essential points are before you write. Don't use unnecessary graphics, as this can interfere with screen readers. Describe them if you do, especially if they are electronic. Use a minimum font of 14 for all your documents, and with a sans serif font like Arial. This makes them easier to read for the widest possible audience. Whenever you produce a document, keep an up-to-date original in an unformatted document. This can then be put into other formats more easily. Patients will often know what they need if they use assistive technology. After all, we are all the experts in our own experience.